Pregnancy is a time of immense change and joy, but it also places incredible strain on the cardiovascular system. For any woman, high blood pressure during pregnancy or gestational hypertension is a serious and often life-threatening condition that demands urgent attention. This isn't just about managing a number, it's about protecting two lives. Many women don't realize that hypertension during pregnancy can lead to conditions like preeclampsia, which can result in premature birth, stroke, and organ damage. In this video, I'm going to break down the 3 critical types of hypertension in pregnancy and outline the 5 essential warning signs that every woman and her partner must recognize immediately. Good day and welcome to HeartHealth. I'm Dr. Ed, a cardiologist. We need to treat high blood pressure in pregnancy with a different level of urgency than chronic hypertension. The risks are magnified because the condition affects the placenta, the mother's kidneys, and potentially the baby's growth. The confusion often lies in the different types of hypertension. Some existed before pregnancy, some developed during, and some are severe and rapidly progressive. As a woman, you are carrying an extra 40% of blood volume, and your heart is working 24/7 to pump for 2. This increased workload makes the vascular system highly vulnerable. We'll start by clarifying the types of hypertension. Then we'll move into the specific symptoms that signal a true medical emergency, empowering you to advocate for yourself and your baby immediately. Hit the like button, share, and subscribe to the channel if you find this information useful. Let's begin. We'll group the essential information into 5 clear warning signs and symptoms that demand a call to your doctor or midwife right now. There are 3 types of high blood pressure in pregnant women. Chronic hypertension, high blood pressure present before pregnancy or developing before 20 weeks. Gestational hypertension, high blood pressure that develops after 20 weeks of pregnancy without excess protein in the urine. Preeclampsia, high blood pressure that develops after 20 weeks, accompanied by signs of organ damage, most commonly detected by high levels of protein in the urine. This is the most dangerous form. If any of these warning signs are repeatedly noticed, then your body is trying to warn you about a developing underlying problem. Sign 1. Severe, painful headaches. The first and often most critical physical warning is a severe headache that simply will not go away or is not relieved by typical rest or mild pain medication. Most pregnant women get headaches, but a headache linked to dangerous hypertension, particularly preeclampsia, is different. You need to look for a headache that is throbbing, often frontal, and feels unrelenting. This pain is a physical signal of increased pressure on the blood vessels in the brain. Unlike a tension headache, this one does not respond to calming down or lying down. If you have a headache that persists for hours, feels significantly worse than normal, and is accompanied by other visual disturbances, you must immediately check your blood pressure and contact your provider. Sign 2. Abnormal swelling and rapid weight gain. Swelling, or edema, in the feet and ankles is normal in pregnancy. The danger sign is when the swelling becomes sudden, dramatic, and affects the face and hands. This sudden, non-releasing puffiness is not normal. It's a signal that the kidneys are struggling to manage fluid and salt balance due to the high pressure, leading to rapid fluid retention. You may notice your rings no longer fit, or your face appears markedly puffier overnight. Coupled with this is rapid, unexplained weight gain, sometimes 2 to 5 pounds in just 1 week, which is fluid, not fat. This severe and sudden edema is a classic red flag for preeclampsia and requires immediate medical evaluation. Sign 3. Changes in vision. The eyes are a crucial window into the health of your small blood vessels. When blood pressure is dangerously high, it can compromise the tiny arteries and vessels in the retina. The symptoms are clear: flashing lights or spots, like fireworks, blurring of vision, temporary loss of vision, or seeing an aura. These visual disturbances mean the vessels supplying your eyes are being acutely affected by hypertension. This is one of the clearest and most direct physical warnings that your pressure is dangerously high and threatening fragile organs. If you experience any persistent change in vision, you must seek medical attention immediately, as this signals that the hypertension is at a critical level. Sign 4. Severe pain in the upper abdomen. This is a less common but extremely serious warning sign that is often mistaken for heartburn or severe indigestion. Severe pain in the upper right side of the abdomen, right below the ribs. This pain is typically caused by the liver swelling due to the high blood pressure overwhelming the organ. This is a sign of severe preeclampsia, often progressing to HeLOP syndrome, hemolysis, elevated liver enzymes, low platelets, which is a life-threatening obstetric emergency. The pain can be sharp, tender, or feel like a continuous ache. If you experience persistent, intense pain in this area, do not try to treat it with antacids. You need to go to the hospital immediately. Sign 5. Sustained vomiting and nausea. While morning sickness is common in early pregnancy, persistent nausea and vomiting that is sustained, severe, and develops later in pregnancy, after the first trimester, can be a critical sign of hypertension and organ distress. When the kidneys and liver are under severe strain from high blood pressure, the buildup of toxins and the overall systemic stress can manifest as profound and sustained nausea and vomiting. This is not the typical hormonal nausea. This can be coupled with extreme shortness of breath, which is the body struggling to manage fluid that is backing up into the lungs. If you experience this severe nausea combined with any other sign, it indicates system overload. In summary, hypertension in pregnancy is defined by 3 types: chronic, gestational, and the critical form, preeclampsia. The 5 essential warning signs you must know are: 1. Severe, painful headaches. 2. Abnormal swelling and rapid weight gain. 3. Changes in vision. 4. Severe pain in the upper right abdomen. And 5. Sustained vomiting and nausea. Please do not wait for your next scheduled appointment if you experience any of these symptoms. These are medical emergencies that require immediate contact with your healthcare provider or a trip to the emergency room. Being informed is the best way to protect both you and your baby. If you found this video empowering, please consider subscribing to HeartHealth. That button helps us reach more people who need this vital information. I'd love to hear from you. Which of these hypertension types were you least familiar with? Let me know in the comments below. Thank you so much for watching, and as always, take care of your heart.